on your mouth to the Dr. Raj Live.
Alright, this is Dr. Raj. I'm getting my blood taken. I'm going to be getting platelet-rich plasma with amniotic stem cells combined. And we are going to put them in both of my shoulders. So right now, initial step number 1 is getting the platelet-rich plasma. So this entails getting some blood, 10 cc's, up to 10 cc's, 6 cc's, so whatever it takes. And then once I get the blood, we will spin it, and we'll show the process afterwards. Process is Canadian, process is American.
What I am going to do is I am going to place Dr. Raja Gopalan's blood, which we have collected in this tube, into this centrifuge. We're going to spin it for 8 minutes at a speed of 34. That's what we're going to do. So, do you want to take a look in here? We have this tube already filled here because we need to balance it out. The weight has to be even. And so this tube here is filled with water to the top. And now what we are going to do is go ahead and place this one directly opposite to the tube that's already in there, which is, like I said, stated before, filled with water. Now that that's in there, I am going to go ahead and close the lid. We are going to go ahead and adjust it. So I set the time to 8 minutes, and we want the speed to be 34. Now that I have this I have to make sure this is completely closed. And now that we have our time and our speed set up, we can just go ahead and press start. And in 8 minutes, the blood will be ready. The red blood cells and the plasma will be separated, and the plasma will be injected.
What we have here is pure amniotic stem cells, fresh frozen, sent in packed ice from the Midwest. So straight from the placenta. These stem cells are taken, stored under fresh frozen, so they've not been manipulated. What I'm going to do right now is I'm going to thaw these stem cells out. I'm going to combine it with my PRP, mix it in 2 syringes to inject both of my shoulders. Now, obviously, if this doesn't work, the next step is real stem cells. And to be honest with you, I'm a little chicken about taking my own bone marrow derived stem cells myself. Actually, I wouldn't do it myself, but I'm a little fearful at this point, and I also, for the sake of science, I want to test out the amniotic with PRP. If it works, then I can come back to you and say this worked beautifully. Skeptical in the sense that in a joint sometimes there's not a lot of blood supply, so if we actually, these stem cells and PRP are supposed to attract your own stem cells, there's not a lot to attract from if you have a relatively avascular environment. So this is what it looks like. I will then have my assistant Allison just hold this in her hands, just to thaw it out. Just hold it, just like the problem. This is my PRP. Good job, Allison. Okay, so we took out about 10 cc's of blood, probably more. She's looking at me more. And this yellow part at the top is PRP. This is platelet-rich plasma. This is what Kobe Bryant, all the athletes got in order to correct their problems decades ago, actually 1 decade ago, between 2000 and 2010. This is what people flew to China, to Germany to get done when all of this was taboo here. So what I'm going to do right now is I take it 5 times to we have now have our PRP. We want to mix a little bit of the red blood cells. Like, as you can see, all of this is coagulated at the bottom. So I'm aspirating half in 1 syringe. The PRP. Done. Ta-da. And then we'll throw this away. So it seems like everyone in the office is office shy, camera shy, except for Allison right now. They're all camera shy.
Let's just say I grew up in school plays.
Okay. Just aspirated the stem cells. We aspirated the PRP. This is the residual in the trash now. We now have the combination. Combination is stem cells, PRP, a little bit of marking in both syringes. This one will go on my right, and then this one will go on my left shoulder. So right now, Giovanna's my PA. She is going to do what she normally does. She's going to take my mixture of my stem cells, my platelet-rich plasma, and a little bit of Marcaine, and then inject it right into my shoulder, subacromial space. She's already marked the areas. My shoulder's tight, super tight, because it's been going on for years. So what I'm doing is I'm purposely pulling my shoulder down, and they call it relaxing. So I have Allison holding my shoulder. She's using some cold spray because she likes me. And she wants to numb up the area. And she's sweet and gentle. And then in a second, I'm relaxing. She's right in there. I feel it moving in.
All done?
And I'm done. So this has been my weekend injury, where I was doing pull-ups, shoulder presses. 2.5 hours later, I tweaked my shoulder. And I felt some sort of quick prick in the shoulder, and I've been having pain ever since. So I believe it's tendonitis. So in general, I didn't get an MRI yet, but this is exactly what I would do even if I had an MRI first. Couldn't even envision shoulder.
Just relax.
Perfect. Oh my goodness. Who taught you how to do that so quickly?
You did, doctor.
She's very good.
Say to me and tell my dad, Dr. Ross.